Merhaba. 7 Nisan Dünya
Hello.
Sağlık Günü kapsamında
So within the scope of 7th April World Health Day, the Film Days event is made possible by the generous financial support of the European Union within the scope of Refugee Migrant Health Project that has been run by the WHO Turkey in collaboration with the Republic of Turkey, Ministry of Health. First of all, we would like to welcome you all to this organization called Leave No One Behind. Today, we are going to talk about the film AMAL, and with the director is Carolyn Proctor, and the aim is health and health for all. So most of the time it was very emotional. It was a very emotional documentary because there was a bomb attack and then this person loses her kids, and then she was homesickness. She was suffering from homesickness, and also there was some differences between the generations. So we can see the integration problems in this movie. And today we are going to have two different guests. We do not have any representatives from the movie, but we have Dr. Ahlam Özmen together with us. She is a pediatrist with 30 years of experience, graduated from Aleppo University and then specialized in Damascus University, now working in Refugee Health Training Center. We have Dr. Serap Şener with us, graduated from Cerrahpaşa Faculty Medicine and then had the PhD in Hacettepe University and then continued her education in Leeds master's programs. And she has been working in WHO Turkey's office as of 2010 and focusing on the violence against women, and she worked as project director in those kinds of projects, and she's been working as an expert in all those projects. We would like to welcome you all once again, and it's our pleasure to be with you in this talk. So in this Amal film, when we have seen their pains, actually the pain of the mother, I could not stop myself crying. So what did you think, Ahlam? How did you feel about that?
أتكلم أنا؟
Evet, lütfen.
كما قلت سابقا
As I said earlier, when I watched the film, I remembered my own experience. When I left my house, my friends, my work, my children as well had to leave their study and friends, and we all came to Turkey. The story of the film sums up the suffering of all the Syrian people. It reflects a realistic story. It also shows how children integrate more rapidly than adults. The movie only shows that some women find more difficulty to integrate or to adapt than men. I also liked how the education and health services are provided for refugees. The same happens here in Turkey. Refugees in Turkey receive health and education services. I liked very much, I was impressed, I was actually touched by the song at the end of the movie. Some of my Turkish friends who know some Arabic like this song, but I can't even tolerate to listen to it. It's very touching. This is what I have to say.
Yes, thank you very much. Actually, it was very emotional, and you felt the same thing, and it's very valuable for the film. It was so touchy, and we are very pleased to have such films in this film festival. Now I would like to ask Ms. Serap, what did you feel? I mean,
duygu açısından
there are some emotions transferred to the audience, and also there are different health problems and also the healthcare services provided.
Tabii ya, duygulanmamak mümkün değil.
Of
Biz
course, we all got emotional. As the Ministry of Health, WHO, we've been working generally for the programs of refugees, asylum seekers, but of course we touch to their feelings, not only for the planning phases, but we work together hand in hand with Syrian nurses, physicians, and we have home care, home-based care. So we have personnel, Syrian personnel. So we know their stories, we know their tragedies. Sometimes we share their happiness. So we watch them, we witness their experiences and feelings. But while watching the movie, of course, it's a bit different because we have seen different aspects. Losing one of her kids, then changing the country for some other help opportunities for the other kid. So of course it was so touchy for me. And you know, integration,
doğru bir hayat sürmenin temelinde tabii bazı
having a life, of course there are fundamental rights, accessing those fundamental rights,
barınma hakkı,
employment rights, accommodation rights, health, education rights. So when you look at this family from those perspectives, maybe I missed some of the messages because I'm not sure whether the father was working, whether the father had the work permit, but of course some of the rights, they had them. They had their accommodation, and also the kids, they were going to school. And for the health, they don't have any problems. I mean, of course, it was given from a single dimension. But somehow we all know that life is not so easy because all those people leave their own home country, and kids, they cannot be very comfortable when they go to school. When they go to hospital, sometimes they are in need of translators and they are looking for someone from their own culture to get that service. I felt so emotional, but on the other hand, I felt that this family was luckier compared to others. Unfortunately, all those families could not reach those opportunities because we have met with Dr. Ahlam 4 or 5 years ago. There was a training program for Syrian physicians. So we had the opportunity to chat, we shared our experiences, and of course there were great improvements for the rights, and we feel all those feelings inside. Yes, you emphasized on something very significant because the family, you know, this family was not planning to move Germany because first they lose their kids, then they move to Lebanon, then they apply to the United Nations, and then of course there is an office of the UNHCR, and there was an offer given by UNHCR because there was the need of the operation for the kid. For this reason, there was an acceptance with the special conditions, with a limited period of time. The asylum was accepted for Germany. Actually, this was not a conscious migration. This was only to save their own lives. I mean, they moved to Lebanon first. The process was just initiated as such. Dr. Özmen, of course, you come across with such families. There are little kids in those families, and their pain is different. Sometimes they cannot express themselves very well. You work together with children, and also there could be different severe traumas in those families. So have you seen any similar cases compared to the film, or what would you like to say for this special case?
Yes, of course. Because of my work at the refugee center, I always meet not only injuries, but also chronic diseases. Many patients hear that I'm speaking about patients in Turkey. They hear that if they leave Turkey, maybe they can find better conditions or better services. So they apply for the UNHCR. While you were speaking, I remembered the family, a family here in Turkey. I remember the right hand was injured and the girl has very limited movement. And the surgical operation is very expensive. The Turkish government does not cover this type of treatment. So the family didn't wish to leave Turkey, but eventually they had to apply for UNHCR to follow up on the girl. They said that as soon as the girl is treated, they want to come back to Turkey. I believe most of the Syrians who left Syria and chose to go to more distant countries, they did so only because they had to. Personally, I was encouraged to go to Germany or to other European countries many times, but I declined all these offers. I feel that I am closer here to Syria, and maybe someday I will be able to move back to Syria.
Çok haklısınız gerçekten.
Yes, you're right.
Bunu ancak yaşayan bilebiliyor.
You can only feel when you live it, because, you know, being stateless, staying away from the homeland. We always talk on those concepts, but unfortunately, humanity could not provide all those peaceful atmosphere in the world. So for the mental health and for the physical health of individuals, all the time they should try to survive. So what do you think about all those activities conducted in a holistic manner, Ms. Serap, Şener? So how can we take the path to a further step? How could you evaluate all those actions taken?
Aslında belki temayı da burada vurgulayacağız.
Maybe we're going to emphasize on the theme because
bu insanlara, yani burada Suriyeli örneğinden
of course we are giving the Syrian example, but there are millions of migrants, refugees, and they have been in this process, in the process of forced migration. So all the states should understand that this is the responsibility of humanity. This is the duty of humanity, leaving no one behind. So when we consider this theme, all the governmental policies, all the governments should have their political decisions in terms of leaving no one behind. Of course, we have our own roles, duties as individuals, as institutions, but first of all, you need to approach
İnsan olarak da görevlerimiz var ya da
beings. So we have our own roles as human beings, as a school, as a minor institution, we have their own responsibilities. While Dr. Ahlam was speaking, I just remembered in Ankara, the first center for Migrant Health Center, it was 4 years ago. And we were just talking with one of my colleagues, and she was talking about the new Syrian students coming to the school, and she was saying that they came only for a couple of days. They could not play with other children. Sometimes they can play really hard and they can behave in a different manner. So then we tried to think of such problems. While we were chatting, what can we do then with the establishment of this migrant health training center? Maybe the newcomers, I mean the new children and the old ones, actually we did brainstorming and we thought that maybe they can come to the same platform, and they can draw, they can paint together. And during the opening, they made a great art exhibition. They sang the songs during the opening. So this was one of the dimensions. And when I listened to the stories from my colleagues from those schools, I learned that behaviors have changed. They started to come to their school. I mean, the enrollment continued. So this is one of the significant pillars in the education. And then all those individuals started to explain about this health center, migrant training health center. So now it's a very crowded center, health center. There are too many applicants. Yes, children, as Dr. Ahlam highlighted, children can embrace life easier, faster. They learn faster. But of course, the policies of each country should be well prepared and should open all doors for all those children for the integration, and all those rights should be granted. So these policies should be strengthened, and there could be some guidance, or maybe there could be cultural cohesion. Services could be given in the same language in order to ease this transition process. For example, in our health centers, we have Syrian nurses, Syrian physicians, and during all those services provided by them, it's very valuable and precious. I hope all other countries could do that, because all these people will live in a very peaceful atmosphere and will reach all those services.
دكتورة سراب عندما تكلمت.
Sorry, can I say something? When Dr. Serap was talking, I thought about something. The Turkish state and all the WHO and all the organization are working on bringing the Syrians and the Turkish people closer together. But I think we need to work on the other side as well. For example, in schools, Syrian students are encouraged to integrate, but I think also Turkish students need to be guided as well. Turkish students should be told that most of the Syrians who came here did not come out of their own will. They had to because they experienced bad experiences in their country. I believe the majority of the Syrian students, the Turkish students, maybe 80% of the Turkish students and Turkish people are dealing with Syrians very well, but still we need to raise the awareness of Turkish students. So when we speak out integration, we need to talk with both sides. We need to raise the awareness of Syrian students as well as Turkish students. I'm not criticizing anyone here, but I mean, it's natural for children to sometimes, to work on, or according to some, it all depends on their education. So the better the education is, the better the situation will be.
Yes, actually, you touched upon a very significant element. First, the entire community should be well educated. The entire community should accept the new condition. And during those film days and also with all those talks, first, we are going to have an informal training, awareness raising, because you are working on site. You experience and you face to all those examples. Actually, I was so impressed. You know, all those children started to understand each other, started to draw and paint together because it's easier for them to integrate. And also the youth, they can be as an integrity and they can be as a group against the adults. So in order to obtain all these, first we need to make ice breaking and we need to eliminate all those prejudices.
Bu da aslında şey
Haklısınız.
sağlığın çok önemli.
Definitely. Yes, this is also very significant. This is
Sağlık
also one of the
etkileyen bir şey
determinants
bir.
of
İkincisi de sağlık
healthcare
hizmetinin
services.
kullanımı da çok
And
etkileyen bir şey.
secondly,
Yani
the
birlikte
use of
olabilmek.
health services, being together, it's
Haklısınız,
very
tamamen katılıyorum.
important. I fully agree with you, and I also agree with what Miss Ahlam said.
Bir nokta belki gençlerin hani birbirlerini
Actually, the youth, the young individuals, they can generally
ergenliğin sonuna kadar
come
zaten
together and, as of childhood until the adolescence, it doesn't matter. You could be from different countries, different citizenships. But first, there is like prejudgment. First of all, they try to exclude the other one. So it's something different in an indirect manner. So unfortunately, children can feel like that. You're right. All those different and discrimination should be understood and there should be empathy.
Peki Ahlam Hanım.
Now, Miss Ahlam, how do you communicate with children, especially the injured, the wounded ones? I'm sure they have their own concerns. They can be afraid of very minor treatment because, they're not like adults. I mean, going to the physician, whether to have an injection or having some tests. How do you communicate with them? Because we see in the film, there is a very small kid, and this kid will be afraid of everything because, he was too small in the hospital bed. So how do you communicate? I mean, how could we communicate with a special method with those kids?
Actually, it reminded me of something. When I chose to become a pediatrician, I did so because I really like children and I enjoy my work with children. And till now, I'm grateful that I chose this specialty. Children who went through war conditions and were injured during the war. Actually, we don't see now many children affected by the war. I mean injured by the war. Maybe earlier, in the first 2 years of my work here, yes, we met many such children, but recently, we don't have as many. But of course, many children have psychological problems. And when I see children, I believe that, they have some symptoms because of psychological reasons. Maybe because of the living conditions or the family condition. And usually I refer them to the psychosocial support department. So the social workers visit them at home and check on their situation. As for children who are afraid from taking tests, actually, by nature, I'm a calm person. I talk directly to the child. I try to establish a communication channel with the child directly. I have been working here for 4 years now. And actually, many children insist on seeing me rather than other doctors because they don't feel afraid of coming to the clinic. And sometimes they come just to say hello. I really enjoy supporting children, and you have to understand the language, how to reach out to children.
Evet, ne güzel. Peki Serap Hanım,
Yes.
tabii ki savaşlar
Okay. So, of course, we don't want to have all those wars. We don't want to see forced migration. We don't want to see all those individuals becoming refugees. Okay, we all hope for that. But there could be some cultural changes and there could be some advantages in terms of education, in terms of learning a language. And when we watch in the film AMAL, there are two young girls in the family, and being able to ride bicycles and accepting, feeling it as a freedom, you know, because of the tradition, this is not preferred in their own country. However, this is very enjoyable and it's something innocent. I mean, what can be more innocent than riding a bike for sports or for having some fun? For this reason, there is also another positive aspect for opening a new window.
Araştırmadan
Definitely right, because I remember from some of the research, you know, migrants or refugees, when they go to another country, they can contribute to that country and they can benefit from those countries. First of all, when you provide the fundamental rights for all those individuals, accommodation, employment, education, and health, you know, all those kids can have the access to all those fundamental rights. Then they are going to have too many things to give to that host community, and also there will be different opportunities to be benefited. For example, gender issue. There was the gender issue, and this was a discussion between the kids. And we have seen, just a second for that, maybe they discuss this issue between themselves. We don't know because the social gender inequality was discussed among them. And
yine araştırma sonucunda
according to the results of some of the research, you know, the Europe of today has become the Europe with all those migrants coming from different countries or all other internal migration. This was enriching the Europe and making Europe as it is now. And, you know, all those rights should be available. Otherwise, we cannot think of it. But this is something very enriching, the community itself. Right. And in the field of health, so all those services, integration, problems, when we think of all those issues, I see a very big conflict. You know, you keep calm, you explain everything in a very wisdomed manner. So for all those people looking outside of all those cases, you know, there will be huge crowds passing through the borders, crying people, then they try to settle. So actually, this is something fearful for all those people. At the end, then everything becomes calm, everything regulates. So you conduct different activities, and especially you provide training for all those refugees and healthcare workers. All those professionals can work in their own culture, in their own language, and they can provide all those services to their own community members. It's something amazing. I mean, this is my own opinion, but this is like, wow, everything is very nice. Everything is going smoothly. So this is the picture I see. Could you please elaborate that part?
Sanıyorum birkaç hafta önce
Actually, a couple of weeks ago, the students, there was a simulation activity of UN, and while I was speaking there, students told me the same thing. Actually, we are relieved. Everything was not so bad. Actually, after the Syrian crisis, everything was not going worse. We were relieved. Actually, of course, we are not going to feel very relieved all the time because we are talking about a very tough process. But yes, there is a system, and within the system, I mean, this is not going parallel to the system. Everything is going through this system, and this mechanism for providing all those services to the Syrians, this was very significant. As WHO, you know, there are funds given by the European Union, and the first training for all those Syrian healthcare workers, physician, nurses, and also the establishment of all those centers for providing all those services. If I'm not wrong, there are 180 centers. This was well planned, and there will be different centers to be established in the future. So all those Syrian migrants, Syrian doctors, Syrian nurses, as Dr. Ahlam, they provide services to their own community members. This is so nice. On the other hand, there are different opportunities, but there are limited opportunities, and the system is limited in a country. As Dr. Ahlam stated, you know, there are 180 centers, but there are also services for psychosocial support. We all know what is social support, but what does social support mean? This is also very valuable because there are social workers in some centers, and all those social workers understand the conditions of such migrants, and they know what kind of services can be provided, what kind of services can be obtained from all those hospitals. I mean, how can those refugees reach to the medication, or how can they reach to the treatment? I mean, there could be different issues, financial issues, etc. All those social workers guide and explain all those issues to them. And of course, this is very beneficial for the Syrian refugees in Turkey. So this prevents the chaos, actually. So we are more aware. So these Syrian refugees can understand that, okay, I need to go X place for my kids' education, so I can receive this support from Turkish Red Crescent, or I can receive that support from an NGO. So we can say that there is a very good mechanism for the transfer of the knowledge. So this eliminates the chaos experienced at the beginning. But with this COVID-19, you know, this is a general problem for all the countries. This unemployment problem is the case, and of course they work in temporary employment. So there is the conflict, the struggle. It's not ended yet, but we have more regular, more systemic actions. Thank you very much. While you were speaking, actually we were also relieved. Miss Ahlam, finally, we would like to close this panel with our wishes. Our theme is health for all today. So during pandemic periods, I'm sure all those Syrian migrants, they have been affected negatively. What do they experience? What were the additional concerns for them during this pandemic? Could you please share your opinions? Then we are going to finalize the pandemic with our good wishes.
COVID-19 affected Syrians as it affected the whole world. For example, many Syrians are going through financial hardship because they lost their jobs. Many of the houses do not provide healthy conditions. So usually we have 5 to 7 people or even more in one house. So whenever someone gets ill, the others get ill as well. The birth rate also increased, and the diseases among these newborn have increased as well. COVID-19 is really a major problem, and I hope we can deal with it and go over it. When I was listening to Dr. Serap, I was thinking that our centers are providing a lot of services. And when Syrians come to these centers, they feel like they were at home because, I mean, everyone speaks Arabic. They have support on different levels. If they have any problem, the center can help. Sometimes we send a translator or an interpreter with the patient when they go to a hospital. And sometimes we send an ambulance to support the patients. I would like also to speak about vaccines. The percentage of vaccinated children is very high. I remember 2 years ago, I attended a conference in Italy with WHO, and the European officials actually were surprised that were surprised at the high rates of vaccination provided to Syrian children here in Turkey. And they actually liked the idea of providing health services to Syrian refugees through Syrian health workers. Yeah.
Çok teşekkür ederiz. İşte herkes için
Thank you
sağlıktan
very
da bu da.
much. So that's exactly mean health for all and peace for all. So we are going to finalize our talk today. Thank you very much for being here and having your contributions. Thank you very much.
Geride bırakma.
شكراً.
So we
نلتقي قريبا إن شاء الله.
Thank you so much. We hope to meet soon again. Bye.
thank you. Thank you very much.
Bırakma.
So we say leave no one behind. Within the scope of film days, we have made our talk on the film AMAL. All the talks, all the films can be followed from festivals.org, and the film festival can be followed between April 5th and 11th. So we are not going to leave no one behind.